Many hospitals in our region are seeing more patients than normal coming in with COVID, the flu, as well as other respiratory issues. Thank you for joining us. I'm Deborah Morgan.
And I'm Dan Haggerty. This upward trend ahead of the holidays has some healthcare professionals a bit concerned. WRAL's investigative data journalist, Ali Ingersoll, has looked into the information here. Ali, honestly, how significant is this?
Dan, some hospitals are seeing significantly more people now than they were a month ago who are showing COVID symptoms related to COVID. This is all according to federal data. Check this out. WakeMed up 140% in just a month. Cape Fear and Duke Raleigh up 75%. Duke University Hospital is the only one where the number has basically unchanged. They had one less person hospitalized with COVID symptoms last week than in early November. We looked at federal data for Duke, UNC, WakeMed, and Cape Fear. The information shows the impact on hospitals associated with COVID and other related illnesses like respiratory viruses and the flu. Flu numbers are significantly lower than COVID ones, and Cape Fear actually saw their number of flu patients that they had drop by more than half in a month. We've heard that hospitals are full, and the data shows that too. Thousands of beds have been occupied in the last week, and even more people are visiting emergency departments. Now, that's not all COVID related, but hundreds of cases are putting a strain on the system, we're told. And this is all before holiday gatherings. So some of the healthcare workers we spoke with today say that they're preparing for a post-holiday rush once again. More people needing medical assistance in the next 2 weeks. Dr. David Wall at UNC recommended testing for COVID before going to see loved ones, and he says it isn't too late to get vaccinated. Wall says there's proof that building immunity is working because people aren't getting nearly as ill. And once again, the data backs that up. The impact on ICUs this season, fairly insignificant. As these hospitals do prepare, though, for that influx of patients, it's pretty noteworthy that this year, many are not expecting to face staffing issues. Only 3 in the entire state reported that they anticipate having a critical staffing issue within the next week, Dan.
Very interesting to see the data compared to, I think, what a lot of people are experiencing day to day. We all have either been sick or know people who are sick. It has really been a busy season. Ali Ingersoll live for us in the studio. Thanks, Ali.